Okay, the ilioinguinal ligament from the anterior superior iliac spine to the pubic crest. The sartorius from the anterior superior iliac spine continuing down to the pes anserinus on the proximal medial aspect of the tibia. Underneath it, the rectus femoris from the anterior inferior iliac spine down to the common tendon. Vastus medialis from the medial lip of the linea aspera posteriorly coming on down for the common tendon. The vastus lateralis on the side here underneath this tensor fascia lata. That's vastus lateralis from the lateral lip of linea aspera to the common tendon. Underneath the rectus femoris, vastus intermedius from the anterior surface of the femur on down to the common patellar tendon into the tibial tuberosity. Note the aponeurosis on its surface. All right, the tensor fascia lata, the iliotibial band. All right, the tensor is the muscle up here coming from the ascese and a little bit posterior on the iliac crest, going on down to the proximal lateral aspect of the tibia, Gerdy's tubercle. And that is the iliotibial band. The nerve supply to that is superior gluteal. The nerve supply to all these other muscles is femoral. The femoral triangle, bordered by the sartorius muscle, the adductor longus, and sartorius and the ilioinguinal ligament, the femoral artery, and the femoral vein. The profunda femoris coming off of the femoral artery, and there's the main branch of the femoral artery going down, and there's profunda femoris with the lateral femoral circumflex, and then on this side the medial femoral circumflex, and that'll dive down between iliopsoas and pectineus. Very good. You see branches of the femoral nerve coming down, splaying out after it comes underneath the ilioinguinal ligament to supply all the muscles and giving you a medial and intermediate femoral cutaneous nerves. Then the saphenous nerve will continue down the adductor canal, pierce the skin and become cutaneous all the way down to the medial malleolus of the leg. That is the femoral nerve, and also a branch of the vastus medialis. If we take the adductor longus back, we'll see the adductor brevis, and on its surface the anterior branch of the obturator nerve. The anterior branch of the obturator nerve. Adductor brevis, and behind it would be adductor magnus. And also the obturator artery would run in there. Perforating branches from the profunda femoris to supply the muscles in this area. And gracilis, to finish up, gracilis comes from the body and inferior ramus of the pubis bone down to pes anserinus along with sartorius. It's an adductor of the thigh. And underneath this deep, you'll see parts of adductor magnus. Adductor magnus coming in.